Question 1. During a busy shift, a sterile processing (SP) technician accidentally drops a critical orthopedic screw on the floor. Although no one is watching and the department does not handle financial transactions, what is the technician's ethical obligation regarding this contaminated item? A. Wash the dropped screw in water at 140 degrees Fahrenheit, and place it back into the surgical set to save hospital money. B. Discard the screw or send it to the decontamination area for proper reprocessing, guided by their surgical conscience. C. Ignore the incident because ethics considerations only apply to hospital administrators managing budgets over $10,000. D. Document the event and quarantine the item at a distance of 8 inches away from clean supplies. Correct answer B. Knowledge point explanation. Core rationale, ethics in the sterile processing department, SPD, are not tied to handling money. They are deeply rooted in patient safety and the surgical conscience, which dictates doing the right thing even when unobserved. Trap analysis. Option A is wrong because washing an implant at 140 degrees Fahrenheit does not achieve sterilization and violates infection control standards. It would only be correct if performing an intermediate step in mechanical cleaning. Option C is wrong because ethics apply to all healthcare professionals affecting patient care, not just administrators. Option D is wrong because quarantining at an arbitrary 8 inches does not address the contamination of the item itself. This would only be relevant for generic sterile storage distance rules on shelving. Concept extension. The Safe Medical Devices Act, SMDA, legally requires facilities to report malfunctions that cause injury, further linking technician actions to ethical and legal outcomes. Question 2. A facility manager tasks a technician with optimizing the inventory in the sterile storage area to practice proper resource management. Which of the following actions demonstrates the correct approach to controlling costs and reducing waste? A. Stacking heavy rigid containers weighing 25 pounds on the highest shelves to maximize floor space. B. Ordering excessive amounts of backup instrumentation to ensure the department never runs out of supplies. C. Implementing a strict first-in, first-out (FIFO) stock rotation system to ensure older packaged items are used before newer ones. D. Discarding newly purchased surgical instruments if they do not match the exact brand of the older inventory. Correct answer C. Knowledge point explanation. Core rationale. Resource management directly involves lean efficiency, minimizing waste, and controlling costs, which is optimally achieved through proper inventory rotation methods like FIFO. Trap analysis. Option A is wrong because stacking 25-pound containers on high shelves violates ergonomic safety and risks injury. It would only be correct to place them on middle racks. Option B is wrong because overstocking ties up facility capital and increases the risk of items expiring. Option D is wrong because discarding functional new instruments destroys capital. This would only be correct if the items were defective or officially recalled. Concept extension. Case cart systems are heavily utilized in resource management to ensure only the specific instruments needed for a scheduled procedure are pulled, preventing overprocessing. Question 3. To be considered proficient and ensure patient safety, what is the true scope of instrument identification a sterile processing (SP) technician must master? A. They must be able to identify exactly 100 basic surgical instruments. B. They are only required to identify the specific instruments used in the operating room, or on that given day. C. They must be capable of identifying thousands of complex surgical instruments, not just a limited approximate number. D. They do not need to identify instruments visually because electronic tracking systems perform all identification tasks. Correct answer C. Knowledge point explanation. Core rationale. Modern minimally invasive surgery utilizes highly sophisticated tools, requiring technicians to identify thousands of different instruments to ensure sets are complete and safe, far exceeding a basic count of 100. Trap analysis. Option A is wrong because 100 instruments is a severe underestimation of the vast inventory in a modern facility. it would only be true in a highly specialized, singular focus minor clinic. Option B is wrong because technicians must possess a broad knowledge base to rotate through different surgical specialties at any time. Option D is wrong because while electronic tracking assists workflow, it cannot replace the visual inspection and physical identification required by the human technician. Concept extension. Instrument identification is fundamentally tied to the correct use of count sheets, which act as the recipe for tray assembly in the clean area. Question 4. A healthcare facility has recently transitioned from decentralized processing to a centralized sterile processing department, SPD, equipped with new robotic surgical systems. How should a veteran technician approach this significant transition? A. Process the complex robotics in a standard steam sterilizer at 270 degrees Fahrenheit to save time. B. Adapt to the change by updating their knowledge and learning the precise cleaning and low-temperature protocols for the new technology. C. Soak the endoscopes in a chemical solution for exactly 10 minutes and distribute them immediately. D. Delegate all processing of the new robotic surgical systems to the nursing staff who manage the operating room, or. Correct answer B. Knowledge point explanation. Core rationale. Advancing medical technologies demand that technicians continuously adapt to change, acquiring specialized knowledge for complex instruments to maintain strict standardization and patient safety. Trap analysis. Option A is wrong because complex robotics often cannot withstand 270 degrees Fahrenheit steam and require specific low-temperature methods. This would only be correct for basic heat-tolerant stainless steel tools. Option C is wrong because a 10-minute soak does not constitute proper sterilization for critical surgical items. It would only apply to intermediate disinfection steps. Option D is wrong because modern standards mandate the centralization of instrument processing to specialized SPD teams, not or nurses. Concept extension. The shift towards centralization was primarily driven by the need for exact standardization and the efficient use of these complex, expensive technologies. Question 5. Why is it false to assume that all healthcare facilities use one standard job description for all sterile processing, SP, technicians? A. Because job descriptions are formulated based on the specific structure, services, and needs of each individual facility. B. Because job descriptions are strictly federally mandated by the Health Insurance Portability and Accountability Act, HIPAA, and cannot be changed. C. Because all sterile processing departments, SPDs, are structured exactly alike, making custom descriptions illegal. D. Because job duties only pertain to the operating room, or ignoring areas like the emergency department. Correct answer A. Knowledge point explanation. Core rationale. Sterile processing departments, SPDs, vary greatly in size and scope across different facilities. Therefore, human resources defines specific job descriptions tailored to the unique duties of each position. Trap analysis. Option B is wrong because HIPAA governs patient confidentiality, not the specific functional tasks of an SP employee. It would be correct if the question asked about data protection. Option C is wrong because SPDs are not structured alike. A small clinic's SPD differs vastly from a large trauma center's SPD. Option D is wrong because while the OR is the largest customer, the SPD also serves labor and delivery, the emergency department, and others. Concept extension. Employability skills, such as punctuality and attention to detail, are universally required soft skills regardless of the specific facility's formal job description. Question 6. A newly hired sterile processing, SP, technician is scheduled to cross-train between the decontamination room, maintained at a negative air pressure, and the sterile storage area, kept at a temperature below 75 degrees Fahrenheit. Regarding the use of personal protective equipment, PPE, which of the following protocols is correct for these two distinct zones? A. Full PPE is required in both the decontamination room and the sterile storage area to prevent cross-contamination. B. Heavy-duty gloves and a fluid-resistant gown are strictly required in the decontamination area, but standard scrubs are sufficient in sterile storage. C. PPE is only required in the sterile storage area when handling rigid containers heavier than 25 pounds. D. Standard scrubs are sufficient in the decontamination area as long as the technician maintains a 3-foot distance from the sink. Correct answer B. Knowledge point explanation. Core rationale. The decontamination area handles highly soiled, biohazardous items, making full PPE mandatory to protect the technician. Conversely, the sterile storage area is a clean environment where full PPE is not required and would actually introduce unnecessary contaminants from the outside. Trap analysis. Option A is wrong because wearing full decontamination PPE into a sterile storage area would violate infection control principles by cross-contaminating a clean zone. Option C is wrong because handling 25-pound containers relates to ergonomic lifting mechanics, not the biohazard protection provided by PPE. Option D is wrong because a 3-foot distance does not protect against aerosolized microorganisms generated during the manual cleaning process. Full PPE is always required regardless of distance. Concept extension. Environmental controls, such as negative air pressure in decontamination and positive air pressure in clean areas, work in tandem with PPE to prevent the spread of airborne contaminants. Question 7. Exactly 15 minutes before a scheduled orthopedic surgery, a sterile processing (SP) technician discovers that a critical bone rongeur is missing from the designated case cart. What is the most appropriate way to utilize basic job communication skills to resolve this urgent situation? A. Silently replace the missing rongeur with a similar but unapproved instrument to ensure the cart is delivered on time. B. Immediately call the operating room, or, using professional medical terminology to explain the shortage and offer an approved sterile alternative. C. Write a detailed incident report and wait for the facility manager to arrive the next day before taking any further action. D. Personally walk into the active or suite without wearing surgical scrubs to verbally inform the surgeon about the delay. Correct answer B. Knowledge point explanation. Core rationale. Effective communication is a foundational requirement for SP technicians. During a crisis, timely verbal communication using accurate medical terminology ensures the surgical team is informed and can adapt safely without compromising patient care. Trap analysis. Option A is wrong because making unauthorized substitutions directly violates the surgical conscience and compromises patient safety. Option C is wrong because waiting 24 hours to communicate a missing item for an imminent surgery fails to address the immediate clinical need. Option D is wrong because entering a restricted or suite without proper attire violates strict infection control boundaries and airflow regulations. Concept extension. Handoff communication and accurate documentation on count sheets are examples of written communication skills that prevent such missing items during the assembly phase. Question 8. The physical workflow within the Sterile Processing Department, SPD, is governed by strict infection control principles to prevent cross-contamination. Based on environmental controls and handling procedures, the workflow is officially divided into the management of which 3 specific categories of items. A. Surgical items, non-surgical items, and administrative documents. B. High-level disinfected items, low-level disinfected items, and physically clean items. C. Soiled items handled under negative pressure, clean items handled under positive pressure, and sterile items stored in climate-controlled conditions. D. Stainless steel items, complex robotic items, and flexible fiber optic endoscopes. Correct answer C. Knowledge point explanation. Core rationale. The foundational workflow of the SPD is a strict one-way linear progression divided into 3 distinct phases: handling soiled items, decontamination, clean items, assembly/packaging, and sterile items, storage/distribution. Trap analysis. Option A is wrong because administrative documents are not a primary category of the physical processing workflow. The focus is on medical devices. Option B is wrong because it completely omits the soiled and sterile categories, which are the starting and ending points of the cycle. Option D is wrong because it categorizes instruments by their material and type, rather than by their processing state, soiled, clean, sterile, within the workflow. Concept extension. The Spalding classification system further categorizes these items based on patient risk, critical, semi-critical, non-critical, to determine if they need sterilization or high-level disinfection. Question 9. While resolving an issue with a sterilized tray, a sterile processing, SP, technician must communicate the error. Why is it incorrect to assume that verbal communication is the singular most important and exclusively used skill for an SP technician to exchange information? A. Because verbal communication is completely forbidden in the decontamination area due to the high noise levels of mechanical washers. B. Because written communication and meticulous documentation, such as accurately filling out a count sheet for a 15-pound instrument set, are equally vital for patient safety. C. Because technicians are legally required by the Safe Medical Devices Act, SMDA, to only communicate using encrypted email systems. D. Because only the facility manager is authorized to speak directly to the operating room, or staff regarding missing instruments. Correct answer B. Knowledge point explanation. Core rationale. While verbal communication is critical, written communication, such as documenting sterilization parameters, updating count sheets, and logging equipment maintenance, is equally essential. It provides a legally binding record that ensures standardized workflows and patient safety. Trap analysis. Option A is wrong because verbal communication is never completely forbidden. Despite background noise, techs must still communicate urgently needed information safely. Option C is wrong because the SMDA relates to reporting device malfunctions that cause injury, not dictating day-to-day departmental email protocols. Option D is wrong because frontline SP technicians frequently and necessarily speak directly with or staff to coordinate case carts and instrument needs. Concept extension. The integration of electronic tracking systems represents a modern form of digital communication that bridges the gap between written documentation and real-time status updates. Question 10. A newly constructed sterile processing department, SPD, is equipped with state-of-the-art ventilation and automated robotics. Despite these modern advancements, a technician is handling a 1-gallon jug of concentrated enzymatic detergent. Why must the technician still strictly adhere to safety practices and consult the safety data sheet, SDS? A. Because modern SPDs are completely risk-free. The SDS is only read during the annual inspection to satisfy human resources requirements. B. Because automated robotics frequently malfunction and spray chemicals up to 10 feet across the decontamination room. C. Because no facility is virtually risk-free. Handling hazardous chemicals always presents occupational risks that require proper personal protective equipment, PPE, and safety protocols. D. Because the enzymatic detergent must be heated to exactly 270 degrees Fahrenheit, before it can be safely poured into the mechanical washer. Correct answer C. Knowledge point explanation. Core rationale. Regardless of technological advancements, the SPD is never risk-free. Handling biological hazards, sharp instruments, and harsh chemicals mandates continuous adherence to OSHA, Occupational Safety and Health Administration, standards, the SDS, and proper PPE. Trap analysis. Option A is wrong because claiming an SPD is risk-free is entirely false. The environment inherently contains biohazards and chemical dangers. Option B is wrong because while malfunctions can happen, routine safety practices are required for everyday manual handling, not just in anticipation of catastrophic 10-foot robotic explosions. Option D is wrong because enzymatic detergents operate at much lower warm water temperatures, typically 109 to 140 degrees Fahrenheit. 270 degrees Fahrenheit is the temperature used for high-temperature steam sterilization, which would destroy the enzymes. Concept extension. The Occupational Exposure to Bloodborne Pathogens Standard is another critical safety regulation that dictates the use of PPE when handling soiled instruments prior to cleaning.